This week on the podcast, we're going to see what this guy does every single week.
Let's get started with the Alpha and Omega Health Podcast with Doctors Rachel and Tri Myers.
Welcome back to the podcast, and today we're going to hear what Tri does here every single day, making miracles happen. So
the Omega, the last place you ever want to go, because it's that awesome.
Oh, okay.
That's how it works.
So Tri, what do you actually do here? I mean, it's not amazing like what I do, my precise instrument adjusting. So what is it that you do?
So I will give it to you that you have a very precise like x-ray analysis of what's going on in the upper cervical spine. I would say we do a fantastic job of analyzing just the whole body as we use movement to assess. So
what's that called?
We use a thing called SFMA, Selective Functional Movement Assessment. It is done by functional movement screens, which is like Gray Cook if you're in the athletic world.
I'm not.
Yeah, so those people out there probably tuning into this understand this lingo. Just
or
saying.
Maybe they don't.
Okay, it's time to educate you. So pretty much every college, every NFL, every NBA, every team now uses the FMS model.
So if I'm not like this major, amazing Olympic athlete or whatever, can I still do this stuff?
100%. So the FMS model is pretty much just fundamental movements. So what that means is a push, a pull, a squat, a lunge, a hinge. Can you do those movements without compensating or pain or anything weird? So everyone would always like a hinge. Can you just bend over to touch your toes? A deadlift is what it is.
Can you?
Of course. That's fantastic. Then we have a squat. Can you squat down? Can you get in and out of this chair? Get in and out of your car? Like that's functional type things.
Yeah.
So we just try to add either a load or assistance or whatever to help you with those patterns so that your brain can understand how to do them without causing more problems. So the FMS model is designed not to assess pain. It's not. Hopefully you're pain-free when you're doing the FMS model. That's why they do it with the athletes. But it's looking as a predictor of possible injury.
So if I come in to see you, you use that screening method, right?
Why are you coming in?
Because I have pain.
Okay,
Isn't
we wouldn't
that
do
why
that.
most people come in to
That's
see a chiropractor?
100%. So probably about 95% of my patients come in because they're in pain. That would disqualify them for doing the FMS.
So then do we just not come to you?
That's why we do the SFMA.
Then you come to me.
No. You wouldn't drive all the way down to this. You want to stay here in the cool area.
Anyway.
Where the cool kids are.
Okay.
So you have the FMS, which tells us what movement we want to do. Your rehab.
Okay.
But we don't want pain. So then that comes back to the SFMA, the selective functional movement. That's where we break down a lot of the movements to basic stuff. Chin tuck, rotation. We need to figure out where in that whole body system is it breaking down. Okay. So we use a thing called the joint by joint approach. So I always tell people we start at the foot. So when you bring that big toe up, it makes that arch pop. Everyone understands if you have flat feet, your arches are not stable.
So stop. Everybody try to move just your big toe.
Just straight up. Does it make your foot go up? If it does, that's good. At least you have at least some type of functional arch.
I know they're all doing it right now.
So the thing is though, everyone understands like if that arches are collapsed, which you have 3 arches in your feet, but everyone knows the big one. Arch is collapsed, then that causes the knee to internally rotate, hip to drop, back to hurt. So everyone does like the orthotics or let me go get a overpronated shoe or something like that. They want to artificially try to stack the body so it's in a good position. My job is to hopefully you don't need funky shoes or orthotics or whatever to get it so your body can function the way it's supposed to without those things. But sometimes you need those things at the beginning until your body is ready. So I'm not against orthotics because we do orthotics. I'm not against that, but you shouldn't need that crutch for the rest of your life. I want you to naturally do it. So back to the point, if you have a stable foot, a mobile ankle, a stable knee, a mobile hip, it's a ball and socket joint, stable core, just want to let you know, thoracic spine, mobile, neck stable, upper neck mobile. So what you're doing is it's literally needs to be a stable joint, mobile joint, stable joint, mobile joint. What happens?
What do you mean by stable, like in the spine? So you're wanting it to move upper, but not here?
Correct. So think of like your Atlas Orthogonal, your AO, your occiput. There's tons of mobility in the yes-no type positions number-wise for the upper cervical versus the lower cervical neck. So a lot of like most of the rotation, good like 60, 70, 80 degrees is in the upper cervical neck. The other part is just like 20 degrees. It's like a coupling. It kind of does a little bit at each time. So it's mainly designed to be stable while the other upper part does all the motion like it's designed to. So a lot of our times we're stuck in this fun sitting position, either computers or schoolwork or carrying a book bag or sitting on the couch, eating bonbons or whatever, but we're in this, but don't hate on Bojangles, jeez. So you're in that C-shaped position, so that thoracic spine's locked up and your hip flexors are locked up, and then your neck is kinked in that extension position. Those are 3 areas that are designed for tons of mobility. Now all of a sudden your body compensates to the joints above and below, say your lower back, knees, just say keep it easy. Hips get stiff, then now that mobility is lost, then now the back and knees have to move more to compensate for that motion. But they're designed for stability. So probably about 70% of my people come in with lower back pain and knee pain, but when I assess them, they're technically okay as far as mobility goes because they're moving too much. It's the hips that are not moving, and if I don't fix the hips, it's just a yo-yo effect. Like you feel good until you start moving again. Then you're back in pain. And then over time, like I might blow my ACL out, might blow my meniscus out, or might blow a disc out, all because of hip mobility. So that is the fun approach. Like, so it's a little bit more detailed work on the exam portion. So if I can figure out where exactly your problem is, we can laser beam our treatment to where it's at. So
do you start at, if you're starting at the big toe?
Sure.
Is that really where you start?
Not a lot of times, because we definitely look at the spinal positions first.
Okay, so would you be working on just one specific area, getting that mobile or stable, and then you go to the next area and do the same thing? So
when some people come in, they'll have multiple areas that they cannot move. Say, like thoracic spine's locked up, hips locked up, knees locked up, ankle, foot, everything. But there's typically always one main area on a person that is their main area. So
you do the main area, not the first area in the chain.
Correct.
Oh, okay.
Correct. Now, I'm not saying, so our whole thing is we always work on mobility first, then we work on stability second, because the reason why I don't want to do a ton of exercises over top of a dysfunction, because then you're going to have compensation issues, etc. So, and then once we got the stability working, then we put it all together. Can you have proper mobility and stability? That's called function. So can we functionally move the way you're supposed to? Hopefully you're out of pain then, right? So you don't do the FMS until you're out of pain. Can you have a competent movement patterns? And then once you can move, now can you do it with a load? That's where we would do our exercise progression of working out.
Yeah. I'm not gonna lie, this sounds pretty cool.
I didn't make it sound cool.
Okay, Tri, so you told us about this fancy screening that you do.
It's pretty cool.
I mean, you're a chiropractor. Do you adjust people? Like, what else do you do?
Okay, 100%. The adjustment is the main thing we do. Like I'm a chiropractor, it's what I do. It's the bread and butter. It's the central theme of what I do. So what we always do is, because mobility, we always want to work on mobility before we work on stability. And having joint mobility is crucial. Okay.
So I'm not sure that people are getting the correlation between mobility and your chiropractic. So what are you saying? Is that the adjustment?
Yes.
Okay.
Yeah.
Thank you.
So what we do is whenever we do the standing assessment of looking like bend over, touch your toes, etc. There's 3 reasons why you can't do those things. One is either your joints are not moving correctly, or that's the chiropractic part. We go in there, realign the joints.
Okay.
Either your tissue's super tight. So if I'm coming over and like I'm got some scar tissue, trigger points, whatever here is just spastic, I can't go over this way because it's a tug of war match. I need to do some muscle work, some stretching, something to get that tissue to relax, to elongate. Those are 2 things called a mobility issue. Okay.
For adjustments.
Adjustment is the joint one. Tissue work, stretching, etc. is for the tissue part.
Okay.
Then the last one is a stability requirement, okay? A motor control problem. So if you're super stiff, like just say the neck, you're super stiff with your standing, but then I lay you down on the table and now you're Gumby, you're super mobile. It wasn't a joint problem, wasn't a tissue problem, it was that stability problem. For some reason your body didn't like the load of gravity, and it was in defense mechanism. It is super tight, and I need to figure out why. And so we need to do exercises to help improve that mobility, because that's what you need.
So do you do other therapies?
Yep. So typically what we do is we adjust first. I want to try to improve the mobility. We might do some of the tissue work. We use this tool. It's called an instrument-assisted soft tissue. Grafting was a technique that kind of first started it off, but they kind of get their little underwear in a wad whenever you say Grafting without actually taking the certification, even though we've done it in school, whatever. But we'll sit there and kind of dig that area out. We'll use cupping you ever seen like Michael Phelps back in the day when he, won all those gold medals? He had all those little circles like he got attacked by an octopus. That's kind of what we work on. We put there to kind of the compressive load, either with your finger or an instrument, breaks up type of the tension with compression. The cup is a distraction, so it's opening up that tissue, but it's still opening up for that body to heal up that tissue-wise. Okay. Now, then sometimes to help reinforce that good movement pattern, we'll put some fun kinesio tape on there to try to help that body heal up and reinforce that good posture that you're in. That's the beginning part.
I love that you're talking about the tape, though, as a side note, because do you find a lot of people, because I do, that people will come in using this kind of tape almost like it's a brace?
Oh, 100%.
Or they're just like, they don't know what they're doing, because you can buy it at Walgreens, right?
Yes, you can definitely buy this at Walgreens.
Okay.
So
what is the actual purpose of this tape?
There's two different reasons of why you would do kinesio tape. One is where it does it's almost like a little spider web over an injured tissue. That is if something is swollen, inflamed, bruising, whatever, like a sprained ankle, you would do that to try to pull out the inflammation. So it's pretty cool when you take it off, you'll see like little divots where the tape really open it up to allow that fluid to be absorbed by the body to get it out there. So it helps with fluid and edema and swelling. The other one, which is how I taped you, is we want to try to reinforce that shoulder to stay back. So that would be kind of like the brace type thing that these patients are trying to do, is to tape it in that corrective pattern. Now the bad thing is if you tape it into the wrong corrective pattern, now you're making it do things that it's not supposed to, and you can actually do more harm than good.
So they should consult with somebody who knows what they're up to.
Yep. So get guidance on what to do. We can definitely show you, because you can buy it at Walgreens. You can buy it kind of on Amazon. You can use it. And it's a great tool to do at the house. And we educate patients on how to do it correctly so you can do it at home.
Hey, what other things do you have? Because I know you have more than what we've talked about.
So we do a lot of things at the beginning to decrease the inflammation in the body. So we do the electric stim. We have an ultrasound machine. We have a pulse machine, which is it's like this really cool coil type thing, or really tight copper coils that emits a strong electrical current, pretty much makes a magnet. So what it does is it starts to move your cells at a cellular level. It starts to go down. We can do a whole other video on this one topic, but where it goes through the cell membrane, and what it's trying to do is trying to get the calcium and potassium channels to open up with that positive charge and stimulate the mitochondria. A lot of crazy terms, so we can go over that later. I'm a visual person, so we can kind of draw it out and kind of see little videos and cartoons or whatever. But
anyway, pulse helps people if they're in acute pain, like just got hurt, or is it good if they've had long-term pain?
So great question. I would say e-stim and ultrasound and that type of stuff is really good for the acute setting. Pulse is more on cellular health, so it could be acute and 100% could be chronic. So that one's the wild card. It can jack of all trades, do a lot of things.
I had it done, and it's pretty amazing.
Kind of makes you feel weird and makes you kind of move all around.
Yeah,
but
I know this guy.
Yeah.
But he said he vibrated for a while.
Yeah.
I think a day. I mean, he's kind of an exaggerator, so.
It's good stuff.
Cut.
Okay, so let's wrap this whole thing up about Omega by talking a little bit more about this cracking, popping, snapping, all that kind of stuff that you do.
Okay, so it's complete opposite of what you do for the most part.
That is
Same
true.
results, just a different way of getting it. So I like the old school way. Remember, I like to use the hands.
Oh yeah, it's this guy right here.
So this is an awesome shirt, by the way. I like to be defiant. It's $18.95. Done by the Revolution Chiropractic clothing wear. Shout out to my buddy Dustin Rose. But this is D.D. Palmer. He was he was the founder of chiropractic. So what he did is originally, I think he was in like magnetic healing kind of a thing. Just kind of curious about how the body worked, did a lot of anatomy testing, etc. Well, anyway, he had this guy called Harvey Lillard, and he was deaf for like 17 years. And he was good friends with him, and he had something wrong with his neck or mid-back or something like that. It was a really weird story. He was like, hey, Dee was pressing on him, like, man, you got this really weird little hump right here. I'm gonna push on it. And he pushed on it.
Seems legit.
Oh, of course. Like, anyway.
Thanks, friend.
Pushed on it. It popped. It made a sound. And he was like, oh my gosh, I can hear. So Dee Palmer literally thought he found the cure for deafness. So, of course, he marketed it for it and everything, had all these people come in that were deaf and did all this. Well, didn't find the cure for deafness, okay? But it helped them in so many different other areas of their health. And so he was like, this is so interesting. Like, this person's headaches went away. This person's this went away. Like, my neck pain is getting better. Numbness, tingling, sciatica. Like, he was like, holy cow, we're onto something. And then that's where it just kind of went down the rabbit hole of why chiropractic is what it is.
Kind of like what we're doing right now. I want to talk about your manual adjusting, though.
Okay. All right. Sorry. Another video. Rabbit hole. You got me a little passionate here.
I know.
Sorry. So what it is
you do what he does.
I do what he does. Yeah.
Okay.
Keep it old school, right?
Yeah. Okay. Go
So
ahead.
for the most part, I use the table, and at the table, this is called a flexion distraction table.
Yeah.
So strap your legs in, kind of put you in the right position. The bottom part goes up and down, and what it does is it allows your spine to open and close. Those little bones you feel in the back, those are the spinous processes. And whenever it's properly moving, like, it'll separate and flex and extend, like it'll separate and come back closer together. I put my hands on it, and if it doesn't move and all the rest of them are moving, it's kind of let me know, like, hey, something's up right here. There's a lack of motion in there. That's where the joint mobility issue would be a problem. So then I set up on that, adjust it, then it kind of opens up again. So sometimes you'll hear the pop and the click that, if you pop your knuckles, that sound is not necessarily needed. It's just a byproduct of having the joint to mobilize. Okay, so sometimes people are like, oh, I didn't hear the pop. I'm like, it's okay, it's moving. You don't have to be a crack addict all the time, but it's okay. They feel good sometimes. So that's how I typically adjust, is we do like a motion palpation. I like to see and feel the joint open up and then manually manipulate that at the same time.
Okay. Cool. I still like my technique for the neck.
I mean, that's fine.
Scare me.
I like to hear it, feel it.
Okay.
So thanks for checking us out and listen to this podcast about my cool, awesome place. So just subscribe, do all the fun social media stuff that we have sprinkled around everywhere. Talk to you next time. Thanks.
Bye.
Make sure you follow us on YouTube, Apple Podcasts, Google Podcasts, Spotify, iHeart, Stitcher, and much more. Find it all at aohealthpodcast.com. That's aohealthpodcast.com.